Greetings and welcome to today's Innovations in Facial Plastic Surgery Update. I'm Dr. DJ Verret. Today I'd like to talk to you briefly about some things to think about when selecting a physician for facial rejuvenation procedures. When you think about choosing a physician, it's not only important to choose the physician, but also the location and possibly the anesthesia provider for your treatment. There are many stories out on the web of people who have gone in for fairly routine cosmetic surgery and non-surgical procedures and come out with very bad outcomes. In some cases, unfortunately, even dying because of it. Therefore, there are many things that people don't think about when choosing a physician, which are equally important to the process. There are many resources out on the web, in books and in people's thoughts, about how to choose a physician. Equally important, though, are things to think about when choosing a facility and an anesthesia provider. When you consider a physician, consider exactly what kind of procedure you're having. Are you just having a dermal filler or Botox or Dysport, or are you having a more invasive procedure? Even liposuction procedures are invasive procedures. They're medical treatments and they require appropriate monitoring and follow-up care. If you're considering topical treatments, such as dermal fillers or the botulinum toxin products, ensure that the person doing it is qualified, but also ensure that they have the appropriate treatment available should you have an anaphylactic reaction, which can be life-threatening, or if you simply pass out and have what we call a vagal response. This is not uncommon, not life-threatening, but does require some monitoring during the episode. For more invasive procedures, those which can be performed while a patient is awake but requires lidocaine, ensure that the physician knows exactly what they're doing for the procedure. Large amounts of lidocaine can cause cardiac arrhythmias, seizures, and even death in some cases. A recent report out of Florida indicates that a woman who was fairly healthy and actually a nurse went into a medi-spa, had a liposuction procedure done, but because of a combination of anesthetics, unfortunately died later in the day. If you're having procedures which require something more than lidocaine be used, any kind of anesthetic other than maybe Valium, which is taken by mouth, ensure that proper monitoring is being performed. If the physician who is performing the procedure is also monitoring your vital signs during the procedure, ensure that there is a separate nurse, a registered nurse, who is available to monitor your vital signs. While the physician is focused on the procedure itself, there needs to be someone focused on your overall health. In many situations, it may be important to have either a registered nurse anesthetist or an anesthesiologist present to be able to monitor your vital signs while the physician is actually performing the procedure. When you're undergoing these procedures as well, be sure that the facility in which they're performed is accredited and has the appropriate procedures in place to ensure sterility of instruments and allow for the safe induction of anesthesia. If a procedure is being performed in an office, ensure that the autoclave system is independently monitored by some kind of facility. There are many labs out which perform spore testing on autoclaves. This ensures that the autoclaves function properly on a regular basis. For procedures which are performed using significant anesthesia, either what we call intravenous sedation or general anesthesia, ensure that the facility is accredited by one of the national accrediting organizations. Several which are familiar to physicians include the JCAHO, which is responsible for accrediting hospitals, the the Quad ASF, or the AAAHC. These organizations go to outpatient surgery centers and accredit them for doing significant procedures. By being accredited, you have a guarantee that a facility is following a certain number of guidelines to provide for the safe administration of anesthesia to patients, provide for the appropriate follow-up care, and take care of life-threatening emergencies should they occur. It's not only important to choose a physician properly, but also the ancillary services, both the facility and the anesthesia provider. Be sure that you have an idea of all of those variables before undertaking a procedure. Though a physician may be the best in the world at doing what they do, if they don't have the appropriate support staff, the results that you attain may not be the best possible. For more information about all of this, please visit my website at innovationsfps.com. I'm Dr. DJ Verret. Thank you so much for joining me. Have a great day.